On-the-scene coverage of ACC.13 is supported by Janssen Pharmaceuticals, Incorporated.
Well, hi, I'm Chris Cannon, here joined by Deepak Bhatt for On the Scene. One of the trials presented at the late-breaking clinical trials was the COMM. I suppose we have a conflict of interest being both at tertiary care hospitals in Massachusetts and chief of the VA. But this was a study that looked at elective PCI, whether it could be safely done at hospitals without on-site surgery as compared with at a tertiary care center with on-site cardiac surgery. It was a study. There were 10 hospitals that did not have on-site surgery where patients were randomized 3-to-1 to stay there for their PCI or get transferred to one of 7 tertiary care on-site surgery hospitals. And it was about 3,800 patients randomized 3-to-1, and they found identical outcomes in terms of death, recurrent MI, repeat revascularization. And so I guess very similar to what had been seen with the Seaport trial, but something that's a little nerve-wracking for the tertiary care centers.
Yeah, so I think you're right, Chris. We both have to disclose that we work at tertiary care centers or quaternary care centers, and you know, the prospect of lots of cath labs opening up in the community could adversely affect our lives and practices. But the trial was very well done. The results are believable. Yeah. In fact, in most of the world, ex-US, you know, PCI is occurring without any surgical backup just for practical reasons. They can't afford having cardiac surgeons and cardiac surgery at a lot of hospitals. So the results really make a lot of sense. I guess the really big question, though, beyond the science of the trial, which is solid, is what are the policy implications? Because the study shows that the outcomes are similar. Should we then just have a proliferation of cath labs throughout the United States? And I guess I'd say no, because we don't really need more cath labs in the United States, barring some geographic issues in more remote areas. But in urban centers like Boston, New York, I mean, would it really help those areas to have more cath labs? Right. I don't think so, and I realize that at least as long as fee-for-service medicine continues, there might be some incentive for hospitals to start their own cath lab. It could be more convenient for patients not having to drive in and find parking at a busy referral hospital. So there's some practical issues there, but does it really help the patient? You know, this trial, the outcomes were similar, but there are those occasional patients where you're doing a PCI, perforate an artery, and having a surgeon on site to step in, can be life-saving. Yeah. I'll concede most of the time there's not an operating room on standby, so even if that perforation occurs, there's no operating room to immediately move the patient to, but still, I think there's some value. And beyond that, we're moving to this concept of the heart team and the general cardiologist, the interventional cardiologist, but also the cardiac surgeon is part of that. And if there isn't cardiac surgery around, it's harder for them to give input at the point of care. So, I still think there are advantages to going to a place that has a cardiac surgeon that can bail you out.
Right. That's a good point. I think to be emphasized that the program that they set up at these 10 community hospitals was very rigorous, that they had volume requirements. I think it was 300 cases in a year, and each interventionalist, and they had to be board certified, and they had to have a transfer thing in place. It was used, I think they said 7 patients needed emergency transfer and cabbage, and they all did well, but in part because it was such a well-done program. Right. So I suppose the just opening up a little cath lab is probably not the answer, but within the context of a true program, that this looks like a feasible option.
Absolutely, but intervention's been under the gun lately for a variety of reasons, questions of levels of appropriateness of procedures and so forth, and in that environment, it's just hard for me to see how we can just inject a whole bunch of new cath labs there,
Yeah, no, it's very well taken. Well, thank you very much for watching. I'm Chris Cannon and Deepak Bhatt for On the Scene.